Hello, everyone. Good evening. My name is Lance Ricappa. I'm one of the chief residents at University of Miami PM&R program. Thank you for joining tonight. We really appreciate your time and attention. I'm joined tonight by my program director, Dr. Molinaris, as well as our program coordinator, Caretha Davis, and last but not least, my fellow co-chief, Dr. Maddie Alderman. So I'm going to be telling you guys about our program today. Really excited because we have something great down here and we'd love for you guys to be a part of it. And please feel free to go in the chat to ask questions. Like I mentioned, this Dr. Molinaris, Dr. Alderman, and myself. So I'm going to first talk to you guys about the facilities we have here, which I greatly appreciate them. We're home to one of the biggest hospitals in the country, Jackson Memorial Hospital, where we derive many of our patients from. So there's no shortage of diversity and patient pathology that we see at this over 1,500 beds that we have at Jackson Memorial. We're attached to Ryder Trauma Center, so we do see some very acute trauma patients. And that leads us to where we mainly reside in, which is Lynn Rehabilitation Center. It is a very new facility that has 72 beds that you'll spend most of your time here at the University of Miami PM&R program. And that's pictured in the top right. And when you're not in that facility, you'll be rotating through many of our other University of Miami buildings here. They're very new, very nice. We have the Lennar Center as well as the CRB building. And across the street from us is the Veterans Affairs Hospital. And you do spend a PGY4 rotation at Mount Sinai in the bottom right. One thing that's nice about our program is that it's very consolidated onto one medical campus. So you are going to see a lot of your co-residents and you're going to be able to bond with them. You're going to be overlapping a lot of rotations and some shared space. So there's parking garages, a very accessible medical campus that we all have come to very much so appreciate. As in any other big city, you want to minimize as much transport as possible. It is nice that we all can park our cars in a parking garage and walk around amongst clinics and hospitals. It's very user friendly, both for patients and medical staff. So a little bit more about Lynn Rehab, where you'd be spending most of your time here. Like I said, it's very new. There's 9 floors. 3 of the floors are reserved for patients' rooms, 6, 7, and 8. There's 3 floors for gyms. And like I said, it's connected to Jackson Memorial via hallways, which is very convenient. There's also outpatient clinics here. As you can see here, this is the gym that our patients do their rehab in. The right side is the inpatient gym. The left side is the outpatient gym. Patients love coming here for a number of reasons, the gym being one of them. It's a great atmosphere in there. Sometimes you'll go on rounds and find your patients in there and ask them a few questions. The patient rooms are very nice. Your patients are very appreciative once they're out of Jackson to come over to Lynn and have these very nice independent rooms with a nice window overlooking the city. And then there's a courtyard on the outside if you want to go catch a lunch. There's a basketball hoop out there as well. It's a good place to go wind down and get some of that Miami sun. We are home to inside Lynn on the first floor, a pool where a lot of our outpatient staff members, they'll offer outpatient PT to patients here. And it is great to see our patients using the pool. And there's also a treadmill built into the pool to analyze gait. I've had the privilege of seeing a few patients in there and very grateful for this resource as well. So a little bit of, why UMiami. This is just a few of our strengths, but we've been around for quite a bit now. We have a SCI model system. We're also trying to bring in a TBI model system as well here in the near future. Kind of talked about the pathology already. One of the key things in residency is exposing yourself to a variety of patient population, not only ethnicity, but also diseases. And all of our patients have different backgrounds, different stories, different situations, and I really do get enjoyment out of treating our patients each and every day. So that is something we have here. We have patients that are flown in from the Caribbean, South America, as well as other parts of the United States to come to Jackson or Ryder and to eventually do rehab with us. There's a lot of procedure exposure here. Our attendings very much so advocate for autonomy. They're right there with you if you need it, but they want you to get hands-on as soon and as often as possible. No matter what you're interested in within PM&R, I didn't know coming in, but there is really a subspecialist in our program for you. I really don't feel like we have a weakness when it comes to that. So we're very well rounded in that aspect, whether you want exposure, attending to talk to, or patients to see, there's no shortage of exposure and getting you to the fellowship or career that you want. We also have some supplemental courses. We take our curriculum here very seriously. We want people to succeed both with practical skills like ultrasound and interventional spine procedures, but also the things like board exams. Areas that we're trying to improve upon and have made progress. We have a new lifestyle medicine curriculum in which we are taking a different approach to medicine, things that we just don't typically have time to or think to talk to patients about. And it's a supplemental residency curriculum that we're just seeing great results with. And it's really adding to our repertoire and what we can offer patients when they come to us. We're also expanding upon our sports medicine prowess. So we're getting more involved with our family medicine department, in addition to our own amazing attending Dr. Chu, to build up a bigger sports medicine presence here at U Miami. We also have a dedicated research time that we want all of our patients to have the opportunities to learn as much as they can and research while in residency. We have an amazing faculty member here, Dr. Chiozo, amongst others, that is so critical to our education because a lot of us came in without too much research knowledge. And last but not least, prosthetics and orthotics. We recently hired an attending here that has a practice that's almost fully dedicated to piano. And we've been working closer with some of the prosthetic companies and building that part of our education. So really happy about all the four things on the right side. I wouldn't consider them weaknesses, more so just opportunities for us in the future, and excited to see where it is in a few years. So we are balanced as far as inpatient versus outpatient, and you do get elective time. You're inpatient, you're going to get the bread and butter, SCI, TBI, comprehensive stroke, cancer, and pediatrics, both at Lynn, but also at the VA. And then all around the clinics, whether it's a UM clinic or a VA clinic, you're going to get exposure to these subspecialties. Just a few to write home about. So I mentioned the sports medicine. We have dedicated days for just sports medicine and a full sports medicine rotation. Additionally, we have this baclofen pump clinic that you'll rotate with our Dr. Ponte, which is a great experience. We have a ton of new interventional pain doctors as well that we're super excited to be working with and getting to learn from them. So just to name a few, there's a lot of outpatient clinics here, and then there's really no shortage of electives here at Jackson because there are so many different subspecialists, being that such a big hospital and so many other different residency programs. So there's really a lot of opportunity there, and it's what you make of it. So just to break down PGY2 to 3 to 4. So starting up with PGY2, you get the exposure to a lot of the, like I said, bread and butter, and that's going to be mostly at Lynn. You're going to bond with your fellow co-residents as a PGY2. You alternate inpatient versus outpatient, which is really nice, so that if you maybe, let's say, like inpatient more or outpatient more, you get to mix it up throughout the year. And as a PGY3, you get to go into more so the outpatient setting. Like I mentioned, sports medicine, pain medicine. You'll get to do consults, which is a critical rotation, as well as a pediatric rehab. And then as a PGY4, you're almost exclusively outpatient. You do one inpatient senior role, in which you're more so acting like an attending, dealing more with administrative stuff. But this is all to say, I would say our rotations are about 6 to 7 weeks long. It's a really nice flow. The rotations aren't too long and they're not too short. And I do think it's a great variety, something for everyone, really. We do have calls as well as night float. Night float doesn't start until PGY3, and you do a little bit more on PGY4. You do start calls as a PGY2. It's call heavy PGY2 year. You have very little call PGY3 and 4. No calls at PGY4, just night float. We do have 2 call rooms. Here's one pictured. They have a TV in there, a nice bed, a fridge. It's quiet. It's a great place to relax when you're not getting phone calls. It's on the 4th floor, so you're right next to the patient rooms. We do have in-house call, and we're very grateful for these facilities. There's also a shower in there and a bathroom attached. So very grateful for this. It makes, those long hours more, much more enjoyable, and they're very new. They're clean, and yeah, that's the call rooms. As far as didactics go, this is a huge emphasis here. We've had great board pass rates in the past. Last year, 100%, and as with previous years, and we want to keep that up. So we have an 18-month didactic schedule in which we rotate through these topics. Our attendings help out with these lectures, and we also bring in guest lecturers, but they're really second to none. There's so much effort, time, and passion put into these lectures, and you can tell when your attending is giving them. And for all of these, there's so much material that they make so much more condensed and very easy to learn. So really grateful for our attendings in these didactics. We have protected time on Friday mornings from 9 to 11:30, in which the phone's off, you're just in a room, and it's all about learning, which is great. There's also supplemental education and curriculum. So we do have monthly journal clubs, which is a great opportunity to expand upon your knowledge in a certain fields. We also have M&Ms, grand rounds, and like the research rotation. So it does give you exposure to a lot of different assets of PM&R into research. We do have board reviews almost every week on Thursdays. It's resident run. We do Kahoots. It gets competitive. It's fun. This was recently revamped so that we could get the most out of that hour-long session we have on Thursdays, and it's been going really well. Really happy where that's heading. We also have SAE reviews in December and January to help us prepare for that SAE in January that we typically do very well on. And we also, our attendings help us out with the mock oral exams before we graduate as a PGY 2, 3, and 4. So our attendings here, they really want you to persevere. They want you to do as well as possible, and it shows. Talking a little bit about more about research. So as a PGY3, you'll present a research project, and a PGY4, you'll present both a research project and a quality improvement project. This is a really fun day where you get to hear your colleagues talk about their projects, what they've been working on. There are so many different research opportunities here at University of Miami, including we are closely affiliated with the Miami Project to Cure Paralysis, a lot of neuromodulation research, a lot of pain medicine research. So you get to hear about some really cool stuff, and they present amazing things. And you can use your research block, a 7-week, very relaxed rotation to learn more about research and build your projects. We have all of these resources here. So I came into residency with very little research knowledge, and I'm very grateful for these people that have helped me grow in that sense. So we do emphasize.
We're just giving you a 5-minute heads up. That's all. Sorry.
Thank you. No, thank you. So we do have our interventional spine program here that allows our colleagues that are very interested in pain medicine to get practice with the C-arm. We have OSCEs. This is a great time, very relaxed setting to practice driving the needle. Every resident is involved in this, and we also have our med students come as well. We have our ultrasound course as well as botulinum toxin workshop as well, in which reps come and we practice also placing the needle for spasticity. So the ultrasound course, the spine course, and the Botox really are practical skills and practical workshops and courses that are very essential to our residency program. Very grateful that we have them. I mentioned the lifestyle curriculum. This is new, very unique to our program, and happy to see where this goes. All 8 of our PGY3 residents are involved, and most of our PGY4 are involved. Happy to answer more questions about this later. We have a lot of exposure to med students here through University of Miami, FIU, Nova. So if you do like teaching, please come to us. There's no shortage of it. We have a San Juan Bosco clinic too that we work out in the community. Here we are at PM&R, AAP, and PM&R. We like to have a strong presence at these conferences. Community involvement. So there's lots of community opportunities here in Miami, seeing it's a big city. People like to be outside to help out with sporting events. And yeah, I can't lie and tell you Miami isn't a huge part of happiness here. It definitely makes things so much better. The weather, the people, we enjoy the outdoors quite a bit. Here's some pictures: volleyball, golf, baseball games, basketball. So here's some pictures of us. We have a very tightly knit residency program. There's people from all walks of life from all across the country. It's not just people from Miami or people from Florida. We get a nice mixture of everyone, people from different backgrounds, and we all get along and we're all in this together. So if you guys do get the chance, please come rotate with us, because I don't think my presentation or my words can really put into perspective how grateful I am to be in this program, and how lucky it is that we have this residency program. And yeah, if Dr. Molnares or anyone else, thank you guys for logging in as well.
Yeah, I didn't know if any of you guys wanted to add anything. I saw that you guys were answering all the questions in the chat. Thank you guys so much for doing that. Also, I love the fact that you guys have so many things kind of going on with your program. But if you guys are okay, I think we're gonna try to transition into the next school.
If you don't mind, Akash, I just wanted to
Yeah.
say hi, introduce myself. Nice to meet you, everybody. I'm Diana Molinares. I'm the program director. I just want to make myself available if you have any questions about the program. I just wanted to highlight, it's hard to express everything about our program in the short amount of time, but one of the things that make me love this program as a previous resident and now the program director is the culture of the program and the supported, and that you are a family at University of Miami. So feel free to reach out and ask any questions in the future or now.
Thank you so much.